moving. So this part is called the agonist, but the other part is called the antagonist. So when this contracts, this muscle is contracting, this muscle must completely relax for this muscle to work. When this contracts, this needs to completely relax. So one of them acts as an agonist, one of them acts as an antagonist. Synergist makes the action of the agonist more effective. For example, we're going to learn down here all these muscles. They don't have, a lot of the muscles work together, several muscles together. So that would be the synergist. Okay, you'll see in a minute. So remember some of these nomenclature is some of these medical terms for the muscles. We need to know origin, insertion, and some of the actions. Okay. So let's look at the anatomy first. A lot of the facial muscles help with facial expression, mastication, eye movement, when you're chewing and all that. Okay. So let's learn some of them. So highlighted here in orange. Okay. Orbicularis oculi would be in the eye. Orbicularis oris will be in the mouth. Okay, zygomaticus, major and minor. So remember this bone right here, your cheekbone is a zygomatic bone. Okay, so here's the zygomaticus, major and minor, and the masseter. Okay, masseter, I think is the next couple of slides. You got to memorize it anyway. Masseter right here. I'll go over this side, and the epicranium. Okay, epicranium. So here are, in this chart, you will see some of them, and you just have to memorize some of the origin and insertion and some of the action of what it does. Okay, for example, orbicularis oculi is originated from the maxilla and the front of the bone and the frontal bone. Okay, the maxilla and the frontal bone inserted into the skin around the eye. Okay, what is the action? Is to close the eye. Okay, the oris, which is the one in the mouth. Okay, where does it start? Muscle near the mouth. Where does it attach? To the skin of the central lip. Okay, and what does it do? It closes the lip. Okay, make your lip move, pucker your lips and things like that. So masseter, we already look at masseter right here. Temporalis is right here on this side. Okay, and the sternocleidoid mastoid, this is called the SCM. S stands for sternum. Cleidoid is the clavicle, and the mastoid, you can just say SCM. So sternum right here, clavicle is right here, and attaches to this bone right here, this triangular bone behind the ear. It's called the mastoid. Okay. Again, some of the origin and insertion and some of the action. Muscle of that move the pectoral girdle, the pecs. Okay, we'll look at trapezius, rhomboid major, minor, and all these. Okay, but the one you need to remember are these in orange. Okay, so the big one right here is the pec major, and underneath the pec major is the pec minor. Okay, pec minor, and on the side is the serratus anterior. Serratus anterior. Okay, in the back, this big one is the trapezius muscle, your traps. It attaches all the way to behind by the occiput. And remember, we have a scapula there. Okay, this is the spine of the scapula. Okay, spine of the scapula. And, well, it's in the other slide, but you need to know it anyway, so I'll tell you about it. The rotator cuffs are called the sits muscle. Okay, supraspinatus, infraspinatus. So supra is on top of the spinatus of the spine, on top of the spine. Infraspinatus, teres minor and teres major. Okay, supraspinatus, so it's called the sits muscle. Okay, S-I-T-S. There's one called the subscapularis. Okay, SIT stands for S, I, teres major, and then subscapularis. Okay, I mean the teres minor, not the major, teres minor, and then the subscapularis, which is right under there. Okay, this one you also need to remember is the rhomboid major and the minor. These are all major posterior muscles, and the lats. Major posterior muscles to help with posture. Okay. Arm movements. Okay. So again, study some of the origin, insertion, and some of the movements. Okay, as I just go back to the picture and find where they are. Okay, just think about how it moves, how when the muscle looks, how when it contracts. Okay, what does it do? Okay, remember muscle don't push, it can only pull. Okay, so here's the front. When this pulls, when this shorten, this will bring the shoulder in. Okay, when this shorten, it will bring the arm up. Okay, when this shorten, it will bring the shoulders back, and so on and so forth. Okay, just try to remember where they are. So here is the, remember the spine of the scapula? Supraspinatus would be here, infraspinatus, and teres minor, and then subscapularis in there. Flexors, pec major. Okay, pec major, this big one. Again, here is the inside would be pec minor, and down here would be the serratus anterior. Latissimus dorsi, your lats. It's a powerful extender of the shoulder. Again, extend mean going backward. Okay, adductor arm. Remember, if you can see this, when it's shortened, it brings the arm downward. Okay, and medial rotation. Teres major is back here. Powerful abductor. Remember abduct meaning raising the arm up. Okay, this one. Supraspinatus is again on top of the scapula, the spine of the scapula. It also raises it up. Forearm. There is bicep brachii and tricep brachii. So that's your bicep, that's your tricep. So biceps means that's 2 heads, triceps got 3 heads. Okay, here's the bicep, and here's the tricep in the back. Wrist and fingers, I don't think we need to know this, but just remember your anatomical position. Okay, by the palm would be your flexors muscles. Posterior is in the back of the hand. Abdominal wall. Linea alba is right here in the middle. The linea alba. Okay. Here is the rectus abdominalis. So this on both sides, of course. Okay. External oblique will be on the outside. A little bit deeper would be internal obliques. So of course on both sides. Okay. And underneath this would be your transverse. So you can see the muscle going this way, right? This is the rectus. The transverse actually goes sideways underneath it. Okay, so the transverse abdominalis goes sideways. Rectus goes straight. External obliques on the outside. Internal obliques on the inside. But oblique is, it means it's, slanted. The pelvic girdle, you don't have to know this until we do Ap2 with the female and male genitalia. Muscles of the thigh, So one of the first things you need to know the orientation of the thigh, of the leg. Where is this pointing at? You know, what part is this? So the biggest part of the muscle in the back is your butt muscle, the gluteus maximus. So this is the back. Okay, so these are your hamstrings. Okay, and these are your calves. So on the side of the thigh, so this is your knee. This is the side of the thigh. This is the outside thigh. Outside thigh. This is your IT band. And here is your, attached to the IT band is your tensor fascia lata. Tensor fascia lata. Okay. So here is your glute maximus. That's your IT band right there. IT band. Tensor fascia lata is in there. And inside just on the side of it is your glute medius. Okay, so medius. So this is the side of the knee, outside. Now let's talk about the inside of the knee. There is your adductor longus and magnus. So adductor means they pull the knee inward. Okay, this is the inside of the knee. And the gracilis is that side. Gracilis. Gracilis is right there. The magnus is inside, and the longus is there. Now this one is your sartorius. I don't know if they have it here, but I think that one is part of the one that you need to memorize. It is somewhere in there or in the lab. Okay. Muscle of the anterior and posterior. So again, this is your glute. Okay. Here is your hamstrings. Okay, hamstrings. We call them bicep femoris. Okay. There is the semitendinosus, and inside there's a semimembranosus. Okay. Membranosus. Sartorius also, so here's that muscle I told you about, sartorius. It also abducted thigh. So abducted thigh. Remember, the sartorius is inside. This is the inside of the thigh. Okay. So that's the back of the leg. The front of the leg, you see rectus femoris, vastus lateralis. So laterus, this means it's on the outside. Vastus medialis is on the inside. So this is the outside. Remember, what band is this? This is the IT band attached to the tensor fascia lata. And that's the glute medius. Okay. So at the back of the foot, you have by the calf, you have the gastrocnemius, called the gastroc muscle, and the soleus. Okay, so the is that the end? Oh, I think that is the end. So the gastroc is the big muscle. Where is it? Gastroc would be this big muscle, and the soleus is right underneath there. Okay, right underneath there. That's the soleus muscle. That's the back of the leg. All right, so just remember these. Okay, their origin. So all these extensors, hallucis longus, that's for your toe and all that. You don't have to memorize all these. Tibialis anterior is a very well-known muscle, but I think you might have to know this. Is right there. I think you might have to know this in the lab. Okay, well, that's the end of the muscle.